Our project is going to focus on reducing mammogram wait times.
Our PICO question is, in women, how do timely mammogram results compared to prolonged results influence anxiety and treatment?
The Affordable Care Act covers women over the age of 40 for their mammogram screenings. One baseline mammogram is also covered for women at risk between the ages of 35 to 40. The average time frame for women to receive the results is from 15 to 30 days. Delays in the system also cause prolonged wait times, such as multiple steps, delays between imaging and interpretation and the contact of the patient, patient contact and follow-up appointment, and there's also many people involved.
According to the literature, we found that a delay to diagnosis of greater than 6 months for women with screen-detected breast cancer is associated with increasing risk of lymph node metastasis and large tumor size. Timely reporting of mammogram results helps to reduce anxiety for women with negative results and speeds up diagnosis or treatment in abnormal results. And lastly, a study of almost 300,000 U.S. women found that the average wait time was between 14 to 16 days depending on their facility type.
The problem with prolonged wait times is the effect they have on the patient. Longer wait times increase the patient's anxiety. The patients may experience difficulty getting in touch with someone to answer these questions. There is a low rating of clear result explanation.
We consulted Carrie Johnson, RN, BSN, APRN. The first question we asked was, as a provider, when do you receive mammogram results that you have ordered for your patient? Her response was, it depends. Some radiologists tell the day that they get it done, otherwise they wait for me to call and the facility will mail out a letter to the patient within a month. The second question we asked was, what would you like to be improved about mammogram wait times as a family nurse practitioner? Her response to this was, I would like to see more consistency. I believe that all radiologists should follow some sort of protocol in ensuring that both the provider and the patients receive the results in a timely manner. I sometimes get results the day of, so I believe it could be possible to provide patients with the results the day of or the following day, depending on the results of the mammogram.
I'm about to lose my mind. You've been gone for so long. I'm running out of time. I need a doctor.
Miss Bonner, we're ready for you back in mammogram.
Okay.
Do you have any questions about your mammogram or the results?
How long will it take until I get my results back?
Well, legally we have up until 30 days.
That seems like a long time.
Yeah, it usually just depends on the radiologist and how busy they are and what your results tell us.
Okay, thank you.
You're welcome.
Hello, this is Natalie from Louisville Mammogram Associates. What can I do for you today?
Hi, my name's Rachel Bonner. I was in last week to get a mammogram and I was just wondering if my results were in yet.
Okay, 1 second, let me check. They are not ready yet. Is there anything else I can do for you today?
Do you know about when they'll be ready?
We have up to a month, so I would try and call back next week and I'll let you know.
Okay, thank you for your help.
All right, bye.
Bye.
Hello?
Mom?
Hey, how are you?
I'm okay, how are you?
Good. Have you heard anything back about your results yet?
No, I haven't. It's been 3 weeks. I'm starting to get a little worried.
You think you should call back again?
I think I will.
Or maybe go in this time?
I'll let you know what I do.
Okay.
Love you.
Love you too.
Bye.
Alright, let's take a look at this. It's not looking too good. That looks like it's about stage 2 breast cancer. Will someone give Miss Bonner a call and have her come in to read her results?
Bonner, for coming in as soon as you could. We have your results from your mammogram.
What do they say?
I'm so sorry to tell you, but the results from your mammogram indicates that you have stage 2 breast cancer.
I wish someone would have told me this sooner.
I just had Miss Bonner as a patient, and she had to wait 4 weeks to receive her abnormal results. And I was just wondering if we can collaborate and come up with a smoother system for incoming patients about their results.
Yeah, I agree. We don't want to put them through any more unnecessary stress.
Let's come up with a computerized system that prioritizes patient based on their past history, clinical findings, and results.
Yeah, that sounds good.
What went wrong? The patient waited 4 weeks for results. She had to call the office multiple times trying to get her results. She consulted her mother about what to do, which then placed stress on her mother. She had to go back to the office, and she eventually received the news that she had stage 2 breast cancer, and this delayed her initial treatment by 4 weeks.
The 3 lean methods we used were prioritization, brainstorming, and PDCA. The factors we took into consideration when prioritizing were look at all cases presented, determine which ones needed attention ASAP, understand that longer wait times cause more anxiety, abnormal patients should be put at the top of the list. While brainstorming, we focused on many solutions as possible, implementation of computerized tracking results, notify the patient and the physician, use a result letter template, and provide support groups information for abnormal results. Lastly, we use the PDCA method. Plan. Establish a plan with the expected results. Do. Implement the plan. We acted out the efforts of a shorter wait times for the results on the patient's overall experience. Check. Verify that expected results were achieved. We did this with the literature review. And act. Review and assess progress.
We discovered that there were many components that were increasing patients' wait times overall. Defect in quality. False positives may cause the patient to return for a more painful and unnecessary procedure like a needle biopsy. Waiting. It takes too long, which makes people uneasy and anxious. And lastly, people skills. Patients are often dissatisfied with their overall mammogram experience for many reasons. One being interactions with the healthcare team, prolonged wait time for results, and issues with scheduling follow-up appointments.
Our current value stream map focuses on the time patients spend in office. Upon entering the office, they have to wait to register, then fill out lengthy forms, then wait again to get put into their gowns, wait for the name to be called, have the mammogram performed, wait to check out/schedule a follow-up, and then finally they have to leave the office.
Our future value stream map focuses on cutting down the time that patients actually have to spend in the office. Upon entering, they use an app on their phone or a key tag to scan themselves in for their appointment. They have already pre-filled out the forms online. They wait to be called back. They put their gown on in the exam room, have the mammogram performed. The physician reviews it and possibly gives results right then. They scan out, and then they can use the app on their phone to schedule a follow-up appointment if necessary.
That sounds good.
Miss Missy, we're ready for you out here, Mammogram. Missy, do you have any questions about your mammogram?
How long can I expect the results to take?
Well, right now we have this new program set in place that you can wait up to 30 minutes to an hour, and we will let you know your results if you want to go ahead and sign up on the iPad.
All right, awesome. I'll do that.
Natalie's waiting. I'm going to go ahead and read her results. Yep, I see an abnormal mass there. That looks to be about stage 2 breast cancer. So let's go ahead and call her back so we can give her her results.
Thank you, Miss Missy, so much for waiting. The radiologist has read your mammogram results, and I'm so sorry to tell you that it looks like they've detected a mass, and it looks like stage 2 breast cancer.
So glad I waited in the waiting room and found out my results today.
Yes, since we found it so soon, we can go ahead and begin your treatment if you would like.
Yes, please.
What went right? The healthcare team collaborated to put the patient first. Patient received results at the end of the visit. Diagnosis was made of stage 2 breast cancer in a timely manner, and the patient was able to set up the first appointment for treatments the same day. The Mammography Quality Standards Acts are legislation put into place in 1999 to regulate mammogram results reporting. Mandatory reporting of results directly to all patients. Results should be provided as a summary in terms that are easy to understand. These results must be sent in a timely manner, so no more than 30 days. Suspicious lesions or abnormalities should be communicated ASAP.
Our proposed solutions to reduce the wait time are the healthcare team using an application on an iPad or laptop such as FileMaker. Only one person should examine the results unless there's need for a second opinion. Implementing these interventions will reduce the patient's anxiety, improve clarity of their mammogram results, and recommendations can be given to improve patient satisfaction.
Implementation. A well-rounded system involving multidisciplinary approach includes conversing with radiologists and ensuring all staff are on board, and propose a management, doing a test run to the new system. then prioritization. All abnormal results should receive immediate attention in order to speed up the treatment process for better results and to decrease unnecessary stress on the patient.
To check the progress after implementing this new system, we will use surveys where patients are asked questions regarding their results, understanding of their results, and overall experience. Also, follow-up appointments, which are commonly due to abnormal results needed for further testing.